Today I'm going to tell you about acute hepatitis. Acute means short, hepatitis means inflammation of the liver. So something has affected your liver which is causing inflammation in your liver. Your liver was normal till yesterday. Something has happened today and your liver is inflamed. So what symptoms will you have? Some patients actually have no symptoms. They have vague symptoms like loss of appetite, fatigue, body aches, nausea, a bit of upper abdominal discomfort. But the most important sign of acute hepatitis which makes people alarmed is jaundice. And jaundice is yellowish discoloration of the eyes, your urine becomes yellow, your skin becomes yellow, you start itching. And this is a serious sign of liver disease and especially acute hepatitis. So what causes acute hepatitis? The most common cause of acute hepatitis are viruses. There are certain viruses which you get through food and water, typically hepatitis A virus, hepatitis E virus, and usually it is contaminated food and water. And you could have this contaminated food and water several weeks ago. So it's not like a food poisoning that you had something yesterday and you have symptoms today. You could have had exposure to the hepatitis virus few weeks ago. Maybe you were traveling as a tourist to some other country and you got contamination there. You've come back to your home country and maybe a month has elapsed and now you start getting symptoms of acute hepatitis. So viruses can cause acute hepatitis. Remember, drugs and toxins can cause acute hepatitis. That's why we tell people to avoid any unnecessary drugs, unnecessary supplements, herbal products, which you're not aware of. You know, there's a lot of things which are kind of advertised on the internet about various forms of health benefits, and people land up consuming these drugs. And many of these drugs and herbs and supplements can affect the liver adversely and cause acute hepatitis. Similarly, people unfortunately fall into a trap and start taking hormones to build up their muscles, bodybuilding in the gym and all. These hormones are absolutely bad for the liver and can cause acute hepatitis, jaundice, and further liver problems. And of course, not to forget, excessive alcohol use, especially if you drink a lot of alcohol, let's say over a weekend or over a festival in a short period of time, can acutely and seriously damage the liver, what we call acute alcoholic hepatitis. Once you develop acute hepatitis, it actually recovers. You don't have to do much. The offending agent has to be stopped. So if you are taking a herbal medication, that has to be stopped. Obviously, if you're drinking alcohol, that has to be stopped. And these viruses which I mentioned, hepatitis A and E, usually go away on their own. But sometimes the acute hepatitis can become very severe. And that is what we have to be aware of. This happens in a few percent, 1 to 2% of viral hepatitis. It could happen in about 10 to 15% of the alcoholic hepatitis. When do you need to know that this is getting dangerous? When your jaundice is not getting better in a week to 10 days. When your jaundice is becoming progressively more and more over 1 to 2 weeks. When you start developing severe symptoms like severe loss of appetite, weight loss, you start developing swelling in your legs, or your belly starts distending. It means there is collection of fluid in your belly. Or you start developing episodes of a little bit of mental confusion or a very high fever. These are signs that now your acute hepatitis may be leading to a condition called liver failure. This can be a serious and life-threatening problem. Remember, it is going to happen in a very few people who have acute hepatitis. But one has to be aware, wherever you're getting treatment, your doctor and you have to make a decision that this hepatitis is worsening and you need to seek further help from people who specialize in liver diseases. So I hope it is clear what acute hepatitis is, what causes acute hepatitis, and what are the signs to be aware of which can suggest that you are developing liver failure if you have acute hepatitis. Thank you.